Waitemata DHB has conceded there are gaps in patient records in its mental health unit, He Puna Waiora, gaps that contravene its own protocols. Now, this follows 2 patients dying by suspected suicide within a week of each other in May. Checkpoint last week revealed that both patients were on the lowest levels of observation, meaning they're only located and checked and engaged with at least once an hour. That's despite the parents of the second patient who died warning He Puna Waiora that he was at risk of killing himself and had been talking about his own funeral. He Puna Waiora is supposed to keep a close eye on all its patients, but the deaths of 2 of them means the service itself is under close watch too. Do you think it is a fair expectation if your loved one was in a mental health unit? Is it a fair expectation that you would expect them to be safe there?
Yeah, that would be my expectation, that you would be able to be kept safe there.
That's clinical psychologist Dr. Dougal Sutherland from Victoria University. More from him shortly. Checkpoint can reveal not all scheduled patient observations are being recorded at the He Puna Waiora mental health unit, contrary to the DHB's own protocol. Using the Official Information Act, we requested details of any patient checks or observations that had not been completed to an acceptable standard. Here's part of the DHB's response.
Based on our weekly audits, Waitemata DHB is not aware of any instances where inpatient observations have not been carried out at an acceptable level. When observations are not recorded as having been completed, this is usually because staff were involved in de-escalating a situation with an aggressive service user or protecting other service users from a person who is acting out. Even in these situations, staff continue to observe service users, but this may not always be formally recorded, as the immediate priority was maintaining safety and managing the situation.
It describes the omissions as occasional exceptions, but this arguably presents a significant conundrum. The DHB says it's not aware of any instances where patient checks have fallen short of standards, but at the same time, it's not recording or scheduled observations. These can be anything from finding and engaging with a patient at least once an hour to a high-risk patient being under constant observation with a staff member at arm's reach at all times. But here's what Waitemata DHB's own protocols say about recording this essential information.
Staff allocated to carry out therapeutic engagement observation activities will record this on the approved form and sign the form. Entries should never be recorded retrospectively. It is the responsibility of the member of staff allocated to carry out the observation to keep the record up to date and complete before handing it to the next allocated staff member. The record must be maintained without any omissions.
We also wanted to know what the wait time is for patients discharged from He Puna Waiora to see a psychologist. The answer? Waitemata DHB doesn't know.
We do not record the length of time a person waits to see a psychologist. We only record the fact that a person has been referred to a psychologist for intervention.
Dr. Dougal Sutherland again.
Optimum, in many ways, would not be waiting at all. In an ideal world, while somebody's an inpatient, they would be getting connected with somebody that's going to follow them in their treatment as they go out into the community. And so that once they are released from an inpatient setting, you can then continue, you can pick up that relationship in the community. That isn't typically how DHBs work. They typically have one team that works in the acute inpatient unit, and then when you're finished with them, you get transferred out to the community mental health team. And I guess if you're talking about that situation, it would, well, look, if people have been in an acute inpatient setting, they probably have had a period of being reasonably unwell. Yeah, I wouldn't want them to wait more than about a week or 2 at the most.
Can lives be put at risk in that wait time?
Look, I think potentially. If you're dealing with somebody who's been unwell enough to be in an acute inpatient setting, and that is a small minority of people. It's only maybe 1 to 3% of the population, but ideally you would hope that when they are discharged that their risk has been reduced and managed somewhat, but they've still got to go back out there into their lives and into probably into whatever stresses they've been facing before they went into inpatient care. So I think there's always a risk that, particularly that moving between services, is always a risky time.
Checkpoint is aware of people waiting a month to see a psychologist after being discharged from Puna Waiora. The DHB says to answer our question about wait times, a mental health professional who would normally be providing frontline services would have to review individual cases. And because there is a national shortage of mental health workers, the DHB would be unable to backfill that person, and this would compromise its ability to provide services to patients. Dr. Sutherland from Victoria University says there's a flood of people needing psychologists, but high and difficult caseloads mean a number of them have left the profession. Here's how he rates access to psychologists through DHBs.
Thinking about people's access in a DHB setting to a psychologist, out of 1 to 10, I would say about a 4.
10 being a top score.
To be fair, and to put it in perspective, the government did announce that they're seeking to get 1,600 more mental health staff in by 2023. And the Ministry of Health is certainly very interested in trying to train or help support training of more psychologists. But that is a long-term plan. It takes a good 3 years postgraduate. So that's postgraduate to train a clinical psychologist. So you're not going to see any great increase in numbers for at least 3 or 4 years. That's the system that we're dealing with. You can't starve a service for years and years and years and then comment on how skinny it looks. Of course it looks skinny. That's had no funding. Mental health has never been prioritised. I can't ever remember when mental health was prioritised apart from this most recent budget where they said $2 billion, and it was like, holy moly, what are we going to do with that? Because we've never had it before. So people simply haven't cared.
And that's Victoria University clinical psychologist Dr. Dougal Sutherland there. Once again, we did ask Waitemata DHB to be interviewed on the program. It declined. We got a statement from the Health Minister who says that there is no question that we need to expand our mental health workforce. We need more support workers, more mental health nurses, more specialist clinicians and more trained peer support workers. We need to acknowledge, though, that this will take years to address. He referenced the $1.9 billion investment in mental health made in the budget and says that service is being rolled out over 5 years to allow time to build the workforce.